For those of you who have the opportunity to use telehealth with your clients, you know that having access to telehealth technology to use with your clients can have incredible benefits, but it's not without its challenges. Something that I've found that has been extremely helpful to me and extremely effective with our sessions is to start with a telehealth orientation session. So rather than jumping right into, okay, what are your goals? Let's see how you do on these goals. Let's come up with a plan for an occupation or intervention to work on together. Let's start by communicating with the caregiver or client or both, depending upon the situation. And so I've created a PowerPoint that you could easily create something similar. This is available at TelehealthShare.com for those that are interested in purchasing it. But this telehealth orientation slide deck can open the lines of communication between you and the individuals that will be participating in those sessions. So I just want to give you a little demonstration of what is on the slides. So this example, this telehealth orientation session that I've used with clients has 14 slides. Just the first couple ones are just an overview about what topics you're going to cover. So I encourage our team of therapists to always start by developing that rapport with the client and chatting with them to learn more about them and to share some about you with your client. So you might have something like an interest inventory of some kind. There are so many resources that you can find online that are already created, interest inventories, interest profiles, activity lists of or questionnaires that would identify activities that are important to your client. So these are just a couple examples of things that you might ask or discuss with your client. Now this example is geared towards students because my clientele is grades K through 12. So after you have had a discussion to talk about your interests, maybe complete something like an interest checklist, which is something that I've created over here. You might then share with them some of the interests that you have as well. After talking about your interests, it's really important that you discuss some tips, some technology tips or some internet tips for or with your client. So things like discussing with them the importance of using a wired connection whenever possible, or if wireless, working as close to the router as possible, trying to limit the number of streaming activities that are happening in the home, or if there are individuals playing video games in one room, it might affect if those video games are being played online, that might affect the speed or the connection of your session. When possible, turning off Wi-Fi to other devices in the home, because that can also prevent a slower connection. Something else you might want to do is test your internet speed. There are lots of locations where you can do that. Speedtest.net is one that I've used very frequently. Now, depending upon the video conferencing platform, the speed can make a difference in your session, how effective your session if you have video or audio delays. So it's important that you learn what those requirements are for the video conferencing platform that you are in. Based upon my experience in looking at several different video conferencing platforms, the minimum that you'll want to have is 2 megabytes per second download and upload speed. I've seen that less than 1 is really likely to cause video delays, but there are some video conferencing platforms that really require more than that. And in a month or in a year or in a couple of years, this speed the speed requirements may be different depending upon the changes in technology. In addition to talking about some internet tips, and you may add to this, these are just a couple of things to think about. Some of the most important that I have discovered are challenging. You might have a troubleshooting sheet to reference during your sessions or share that with your parents. I had written a book to identify tips for moving into telehealth in school-based practice. And in there are some troubleshooting tips that I share with my team so that they have a list of try this, try this, try this. These two things, or these few items on this page, are just some of the most important or the most significant challenges that we experience are usually because of their internet connection and their internet speed. Now, beyond looking at their internet speed and their internet connection, it's important that you talk about setting up the space. We cannot assume that our clients or the parents know that, hey, we need a table area. You know, I've had sessions where someone's come in without anything, sitting on the floor. And while there are plenty of things that could be great for some of the activities or the interventions that we are planning on using, it may not be what we need. So we need to be very clear what we need for that session. Particularly thinking about background noise. A lot of students now, when they're doing an online or remote learning of some kind, there are a lot of other things or other children in the home that could be contributing to some increased noise. So it's important to think about that background noise, discuss that with the client, talk about things that you might be able to do to minimize some of those distractions. You want to make sure they know that you might need a flat surface for tabletop activities, room to move for some activities. You might even do a scavenger hunt where you're looking for where you have them look for supplies that you will need for sessions in the long term or just for the following week. There are multiple, if you're on any Facebook groups, I've seen multiple people create really nice looking scavenger hunts to share with your clients. These are some of the things that I ask our clients to be on the lookout for in their scavenger hunt homework. And so this is something that I'll pull up this slide, and then I'll also have a PDF that I send with them so that they can begin to look for as many of those things as possible. Now, in addition to talking about internet tips or connectivity tips and setting up your space and gathering your supplies, it's important, and oftentimes something that we don't address that we should, is looking at and discussing ergonomics for seat work. So here's a really great article you might consider checking out and sharing with your parents for review. Now, some of the most pressing things to talk about is our chair and our desk. How should we be positioned in relation to the floor, the desk? And so those are some things that are important to look at with your client. Additionally, looking at the computer screen, where the top portion of the screen should be at eye level, the keyboard and mouse being at the same level, and then looking at the positioning of the wrist and the arms, all very important to do. I then shift to talking about Ehelper instructions. Sometimes we have parents that are so wonderful. They're there always for support for their client or their child if you're in the student, or if you're in the school-based setting. Sometimes, however, you'll have parents or caregivers who help too much. It enables things where the child does not have the opportunity to develop some of those independent skills because the parent is enabling them or completing the activities for them, or some of the activities for them. So it's important to have that discussion and say, hey, we would love for you to be here for these sessions. It's really important so that you have the opportunity to see what we're working on, because it would be just so wonderful if you could take some of these things that we're working on and use those strategies and those tips throughout the week when we're not in session. But there are many things that we want to see them do on their own as much as possible. So you want to be very clear with them that they're nearby for support if needed, and that you'll let them know, when you need their help. And remember that it's okay if they can't do the task. This is all part of the process. But that they're there to help find materials if needed, or to assist with troubleshooting technical difficulties, or assist with sending work samples as well. So, and then the final thing that I like to chat with them in our orientation session is really talking about a communication plan, talking about the best ways to communicate, what is best for them. Talk about the cancellation or rescheduling guidelines that you have, or the what you will do if you're having technical difficulties, how to submit homework. So all of these things are really important things to identify ahead of time, and creating a PowerPoint like this one here can make a world of difference if you start with this and open the lines of communication. I hope this is helpful to you. We have a lot more tools available for your use in telehealth at TelehealthShare.com if you're interested in checking out any of those, as well as many continuing education webinars that are available to help you on your telehealth journey. So check out TelehealthShare.com. Our goal is really to help empower you to feel confident that you can do this. You can provide effective telehealth sessions with confidence. I know you can do it. Sometimes it's nice to have some of these extra resources at your fingertips to help you along the way. And so just check some of those out when you have a moment.